who are dealing with arthritis every day. Don't go away. Whenever someone tells you you have a child who's sick, it's hard to hear. But especially if they tell you your baby has arthritis. And that's what happened to Deetra Pickens. She and her daughter Sydney are here with us today to tell us their story. And Sydney is 3 years old. Thank you for being here, Sydney.
Thank you.
Deetra, what was it like when you first heard those words? Arthritis.
I was very confused, and her pediatrician, her regular pediatrician, is the one who said to me, I would like for you to take her to a rheumatoid arthritis specialist. And from the time that I walked down from the office to my car, I sat in my car in complete disbelief, because that's, you know, you hear arthritis. I thought of my grandmother right away.
Right, right.
And it was just, no, she's wrong.
Well, Sydney, do you go to school?
Yeah.
Tell me about school. Do you like to play?
Yeah.
Do you have a boyfriend?
Yeah.
Oh, you do? She said, yeah. Okay. What's his name?
Why?
Riley. All right. How does that, now that we've gotten all into her love life here, how does her having arthritis affect things like playing at school with friends? What kind of allowances or exceptions do you have to make?
Quite a bit.
Mommy,
It's a everyday, actually it's a day-to-day situation that we have to deal with. It's a matter of, you know, are we going to have a good day today, or are we going to have a bad day?
What's a bad day like for her?
Bad day is when she is very immobile in the morning, the stiffness, the swelling. She wants to lay around, and she doesn't want to interact as much. So she's a very active child, as we're learning, and we've realized that, you know, the arthritis had slowed her down quite a bit, and now we're seeing that, you know, through therapies and medications, that she's moving around a lot better than what we thought, and we're happy, but we still have good days and bad days.
Yeah, and she's a typical 3-year-old, very active toddler,
Yes.
and I would imagine that makes it even more difficult.
It does.
You've had to make some decisions about her care that included some pretty heavy-duty medications. How difficult was that?
Every choice has been very difficult, and just because we've been dealing with this for a year, things have gotten easier, but it's still challenging. And we've had to go from the simplest of using naproxen, which is like an ibuprofen, and then we're moving from naproxen to methotrexate and Embriol, and those
A lot
two
of heavy-duty words for someone so little.
and so little, but you know, the results that come from it, you keep your fingers crossed all the time. Is this what's going to help?
What would you say to other parents who may be hearing those same words that you did a year or so ago? Biggest piece of advice you could give them?
The biggest, probably the most important thing, that if you have a child that you feel that possibly might have arthritis, find a pediatric specialist. There is a huge difference between adult arthritis and pediatrics. You want that type of care for your child. Not that, I mean, we made that choice. We were like, we have to find a doctor now. We took her to a regular rheumatoid specialist, but it was completely different. The bedside manner was a bit different. This was a child. There were certain needs that she needed. So after being able to have a connection through the Arthritis Foundation and being able to speak with another parent and hearing her child's story, that coincidentally a story came out in a magazine the same time that Sydney was diagnosed with it. So we were lucky to have that connection. But don't be afraid to ask questions. There is no wrong question at all, and go to a pediatric specialist.
Well, thank you so much, Deetra, for
Absolutely.
sharing your story. And Sydney, your shirt says sweet, and you were definitely a sweet girl today. Thank you for coming to visit.
What do you say?
Thank you.
Okay, have a good day.
Lindy.
Thank you so much,
Absolutely.
Deetra.
Thank you for having us.
We will be back right after this. We've learned today that arthritis is not just a disease that affects your grandparents. In fact, we've learned that children as young as 3 months old can have the disorder. And we've also heard with education and counseling and the right treatment that people who have arthritis can go on to live healthy, full lives. Our goal here at Healthy Connections is to always make sure you have information to keep you and your family connected. I'm Annetta Wilson. Thanks for joining us. Have a great day.